Hi, I'm Dr. Michelle Haendiges, and I want to speak to you for just a few moments on why it's imperative to implement a weight loss program for your practice. Let's start with a scenario. Imagine for a moment a bruise, simple, defined, limited, yet caused by a bump against a simple end table. A patient comes to see you each week for this bruise that keeps occurring after each weekend. How would you manage this bruise once you ruled out a life-threatening clotting disorder? Possibly pain medications, anti-inflammatories, skin coloring agents, or possibly anti-swelling agents? Or would you manage the cause? Simply ask the patient to move the end table. Managing just the signs and symptoms would be medically expensive, consume valuable office time, and fail to help your patient. The patient's behavior is not being modified to address the cause of the bruise. Now, let's think and consider obesity. Obesity is the most impactful disease of our lifetime. The trends of obesity are actually quite revealing. If you look at the slides, the rates are continuing to increase to the point that there is no state in the union that has less than a 20% obesity rate. If you look at the other slide produced here by the CDC and their publication Vital Signs, you'll see that obesity is linked to breast cancer, colon cancer, fatty liver changes, high blood pressure, high cholesterol, stroke, depression, arthritis, and the list continues. So what if we actually treat obesity? We minimize the effect of this on our bodies. Medical reasons to treat obesity are long. Physicians, number one, are in a position to change lives through obesity treatment. Obesity is a chronic medical problem. There is no quick fix. Based on the acute care model, we're always reaching for that acute fix. Obesity related to medical conditions is on the rise. Therefore, by managing obesity, there is a decrease in the chronic conditions of cardiovascular disease, high blood pressure, high cholesterol, depression, fatigue, autoimmune conditions, and many, many other chronic medical conditions. Resolution of chronic medical conditions that require more frequent follow-up and more intensive visits can be reduced by managing obesity, the cause, and certainly not just the effect. There are also better outcomes for your patients with increased patient satisfaction. This slide here is a very informative slide that outlines for you the root cause of metabolic syndrome. If you notice, insulin resistance ties in all the conditions of metabolic syndrome. Sometimes we treat each individual condition without looking at the bigger picture. Remember what metabolic syndrome really is. There's central obesity, high blood pressure, high LDL cholesterol, low HDL cholesterol, and eventual blood sugar issues leading into diabetes eventually. In 1998, there was a very interesting study that was published that showed the natural progression of diabetes. In fact, if you look very closely at this slide, you will see that insulin secretion will continue to rise as well as insulin resistance for up to 10 years prior to the diagnosis of diabetes. During this time, the patient is exposed to both micro and macrovascular complications, such as hypertension and atherosclerosis. This slide is very interesting also in that it's a summation of insulin resistance tying into metabolic syndrome that then leads to further impaired glucose tolerance and eventual diabetes. As you know, there is a lot of information in the medical literature about inflammation. You will notice in this slide that inflammation is the preceding event prior to a stroke or a heart attack. One of the best teaching aids that I use is presented here on this slide. It is important to educate your patients about metabolic syndrome and insulin resistance. If you see in this slide, the insulin level will continue to increase and eventually the blood sugar will rise near the maximum point of output for the pancreas. Diabetes is defined as a fasting blood sugar of over 126. You can then look at this chart and see how the entire medical machine is based on treating the symptoms. But what if we can reverse the insulin resistance, actually turn it back? If an increase in insulin causes high blood pressure, abnormal cholesterol, fatigue, depression, diabetes, then what would decreasing insulin levels in your patients do for them. A decrease in insulin means just the opposite. A decrease in abdominal circumference and fat, a decrease in carbohydrate cravings, a decrease in blood pressure and also triglycerides, a decrease in the poor LDL, and an increase in the good HDL. This will also decrease blood sugar and actually help return to normal levels of hemoglobin A1C. Some of the bonuses are an increase in energy, a decrease in depression, and overall sense of wellness. According to the paper published in 2009 called the State-of-the-Art Publication based in a journal or published in a journal called the American College of Cardiology, there are many causal effects of obesity on the cardiovascular system. The following is a mere summary of some of the highlights. We can get to the root of the problem by treating the cause. In a study of 5,881 Framingham Heart Study participants, researchers and others showed that during a 14-year follow-up, for every 1 increment in increase in body mass index, the risk of heart failure increased 5% in men and 7% in women. You see, obesity plays a major role in adversely affecting major coronary heart disease risk factors. And these we well know are hypertension, abnormal cholesterol, diabetes. Those are the main ones, and these are the main components of metabolic syndrome. And is probably an independent risk factor for not only atherosclerosis, but coronary heart disease events. Substantial evidence supports an increased electrical irritability in obesity that may lead to more frequent and complex ventricular arrhythmias, even in the absence of left ventricular dysfunction or clinical heart failure. In the Framingham Heart Study, the annual sudden cardiac death rate was nearly 40 times higher than in a matched non-obese population. These are significant statistics. According to the CDC, heart disease is the leading cause of death for both men and women. More than half of the deaths due to heart disease in 2009 were in men. Coronary heart disease alone costs the United States over $108 billion each year. This total includes the cost of healthcare services, medications, as well as lost productivity. Stroke is another consideration with obesity. Numerous studies have reported an association between body mass index and stroke. In fact, for every 1 unit increase in body mass index in our patients, there was an increase of 4% in the risk of ischemic stroke and 6% for hemorrhagic stroke. This increased risk of stroke may be attributable to a higher prevalence of hypertension, possibly a prothrombotic or a pro-inflammatory state that accompanies excess adipose tissue accumulation, as well as atrial fibrillation. Our circulation is not left untouched. The combination of increased intravascular volume and high volume lymphatic overload, as well as reduced physical activity, often lead to venous insufficiency and edema with increasing obesity. Additionally, obesity is associated with an increased risk for venous thromboembolism and pulmonary embolism, especially in women. Sleep apnea is a huge problem today. Obesity is a classic cause of alveolar hypoventilation and the obstructive sleep apnea, or OSA syndrome. In fact, OSA may contribute to the pathogenesis of hypertension and increased inflammation and C-reactive protein. Clearly, patients with OSA have increased risk of hypertension, arrhythmias, pulmonary hypertension, that's present 15 to 20% with sleep apnea, heart failure, myocardial infarction, stroke, and overall mortality. Examine the effect of treating obesity on your practice. First off, there's several business reasons to treat. First off, it's preventative services, wellness plans, and incentives to manage lifestyle risk related to obesity are key to your financial future. Insurance billing and reimbursement will continue to increase for the services you provide for these diseases. Providers will benefit from being able to treat patients with these diseases and get paid for services rendered. Physicians will soon be measured on patient outcomes relating to patient care and outcomes, along with the management of medical expenditures under the new reimbursement model. Treating the cause decreases office visits, reduces medications and lab testing, and increases overall patient wellness. There can also be a significant growth in revenue as a result from the program fees in addition to the insurance billing and reimbursement incentives. The current approach is not working. We can all agree to this. By studying this graphic for just a few moments, you can see that our current approach to managing obesity is just not working. We are at an all-time high in weight as a nation. What do we continue to do for our obese patients? We tell them to exercise more, eat less fat, and just push away from the table. And we also advocate eating more whole grain products. It is really no wonder the obesity overweight epidemic is now a pandemic. As physicians, we are in the best position for treating obesity. The effects of obesity and nurturing patients to better health is our calling. Let's better equip our patients, achieve better outcomes, and start changing lives. Physicians can change lives. The national rate of obesity or overweight is 67%, but the frequency of conditions or comorbid medical problems can increase the utilization of health care. More than 75% of our patients are likely obese or overweight and have a comorbid condition. It's important to understand the facts. Patients already trust and are bonded to you. Patients are more likely to lose weight if they are told about its impact on their medical issues or their chief complaint. Patients who got advice had a 300% increase in the odds of attempting to lose weight. The majority of obese, over 88%, want help from their doctor in losing weight. 63% of overweight and 84% of obese patients believe that their doctor can help them to lose weight. So what can we do as physicians? First off, we have to know the truth. We have to do our own research. And it's important that we implement an obesity treatment program. So, what can we do as physicians? First off, it's important to know the truth. We have to do our own research, and we can actually implement an obesity treatment program to help our patients. I have found that the best way to implement an obesity treatment program is actually to join forces with Robard. Robard will be your full-service implementation and business growth consultant. You will be assigned an expert business development manager who will utilize step-by-step, turnkey implementation and training guides to assist you with creating and implementing a business plan. You can begin seeing your first obesity patients within 30 to 60 days. For the lifetime of our relationship, you will benefit from Robard's complimentary business growth support and operational assistance from your business development manager. This manager is actively involved in educating your staff and you. Your BDM will leverage an extensive library of resources, including an online staff training tutorial program, educational webcast, business education modules, as well as insurance billing and reimbursement support, annual educational events, CME conferences, and so much more. Robard provides this support to customers at no additional cost throughout the lifetime of your relationship. So what's next? For a free consultation, call 1-800-222-9201 or simply click on the link below this video to request a call from one of our knowledgeable business development managers. Robard looks forward to speaking with you at your convenience and helping you implement a successful obesity treatment program.